George is going to present part of it, and then I'm going to talk a little bit about the successful marketing and implementation. And if any of you, because all of you who are on the call have at least purchased the PPX product. Some of you are doing it super successfully, others are a little hesitantly, and that's why we're here, is to really learn from one another, learn how what peer-to-peer, like what you guys are, what we're doing in each other's respective practices that's working, and what we've built from a company standpoint to help support your practices, because we've done it. We did it with the PRP market, and it's been proven successful. So, George, I'm going to let you take it away.
Sure. Do you want me to share my screen, or we can just...
I'm sure. Yeah. Go ahead. You share your screen.
We can actually, you can leave yours up. It's okay.
No. You can
All right, let me
moderate a little better. Go ahead.
Let me try to do that. Hold on.
Okay. Nice to see everyone.
Nice to see you too.
Hello, Joe. Yeah, I'm just having some issues sharing.
No worries. Want me to just say the word if you need me to share mine.
It's not letting me share. That's the problem.
Okay, I don't know why, but I'm ready to go. So.
All right, so I want to start off by welcoming everyone today. I know everyone had a hard day at work, hopefully. So it's late, and we'll make this quick. I just want to introduce some of our team members. Dr. Michael Bellio, who I've known for about 8 years now from the University of Miami. He has a PhD. He's one of the few people who is really an expert in the field of extracellular vesicles and stem cell research. Because of Michael, we've developed some of these products, including microRNA. Michael will be speaking today, so I'm real excited about having him here with us today. Jill, I know for about 10 years. She was the queen of the PRP industry. She actually turnkeyed my medical practice when I was doing PRP until we developed this second generation PRP. So we were lucky enough to bring her over from her whole career. She left and joined us at Zeo Scientific. And Tammy Bano also worked with Jill and myself for about 10 years now. Those are the two people who, when you work with some people and you know what they can do, they're two people who are just experts in the field of this kind of technology. So we're glad to have them with us today. And there's other people as well. Dr. Robin Smith, I know, is on the call, who I know Robin for about 15 to 20 years, who is probably the foremost expert of stem cells in the world. And we're glad that she's with us with Jody Gurney. I don't know if Jody's on the call too, but
yep, Jody's here.
Big shout out to Robin and Jody, who are leaders in the industry by far. When Robin's on your team, everyone knows you have a team. And Jody's been working with Robin for a while, and I know Jody for a long time as well. And she's an expert in the field. So what I'd like to do is talk a quick agenda. So we're going to really talk about how we developed this concept of what's called autologous exosomes, where they're being used, the regulatory landscape, applications that I've been using in my medical practice for many years, and with the company Fountain Life, where I work as well, and then how to get to the next level, how to eliminate this learning curve, and how to really start using these products to our benefit, and a turnkey solution that will really help everyone. And I have to give kudos to our team for putting together this whole turnkey solution. And when you see it tonight, you're going to be blown away by it. So what are autologous exosomes? So I've been using amniotic fluid-derived exosomes for about 8 years now. And in 2019, the FDA came in and turned up the whole industry upside down. So most physicians, if they're concerned about regulatory matters, they don't want to touch amniotic fluid exosomes, and I don't blame them. So we needed a new solution. So we decided to bring up an interesting concept of using your own exosomes. So how do we make your own exosomes that are older just as powerful as younger exosomes? And it turned out a lot of this research has been brought about by Dr. Michael Bellio, who will talk about it. It's not really the exosome, it's what's inside that exosome, microRNA. And microRNA is the communicator, and that communicates with an old cell, an infected cell, an inflamed cell, to turn that cell around and to regenerate that cell. And hopefully Dr. Robin Smith will talk a little bit about what she's doing with the signature exosomes, because I believe that's the future of this whole industry, signature exosomes using microRNA technology. So is this autologous exosome just like PRP? It turns out I was using PRP for many years, and 50% of the patients would say I received no benefit, and some did. There's a placebo effect in there, but when you draw 60 cc's of blood from a patient in the office, it's a big needle. They have to wait. You spin it down twice. You re-inject it back in, and what are we actually injecting back into the patient? If you're a physician who's on this call, we don't know. We're not looking under a microscope. We just don't know. We think we're injecting something good. Platelet-derived, PRP, what is it? Are there growth factors in there? Are there exosomes in there? Are there any inflammatory markers in there? Are there infected materials in there that we pick up when we draw the blood? Who knows? So I think a better approach is taking that blood, sending it to a laboratory, have the laboratory look at it under a microscope, put it through special equipment that can concentrate it, beef up those exosomes, actually look at the microRNA inside, increase that microRNA, and then send it back to you after it's been evaluated for endotoxins. So you have a clean a specimen, 1 ml, with close to 300 billion concentrated exosomes in there, along with microRNA without bacteria. So you know what you're putting into the patient. And I think that is a better approach than typical PRP. And I probably have done about 3,000 PRP procedures. So I'm more than an expert in PRP. I know what it does. We've injected multiple joints in multiple areas, and it just doesn't come close to the work we're doing with what we call second generation PRP, AKA PPX. The other thing I want to talk about is some patients just don't want to have someone else's blood or someone else's product in their body. So getting your own product or exosomes is a benefit.
And I think if I can chime in there's a perceived sense of kind of exclusivity to autologous exosomes, because it won't be tomorrow, but today we're the only company offering autologous exosomes. So in fact, that means you're the only practitioners that are able to say and market that you are offering something so exclusive. So there is perceived or not, there is a true, and then we'll have Mike speak to actually what he's done in the laboratory to compare PRP with autologous exosome PPX, but it is something that you really need to differentiate yourself, or able to differentiate yourself in your practice setting for your patients or to your patients, because it is exclusive, and understanding the therapeutic value is super important. And Mike, if you don't mind chiming in there, George, if you will, allow him, because this is, he's done some
I just want to say this presentation is more of an advanced presentation. It's not for practitioners who haven't known about this. It's not a basic presentation. It's for people who have the PPX kits in their office, who want to use it and want to know how to use it. What I think is really going to be helpful is when you go to that book you put together, that turnkey solution that will really help physicians. And I think we could do that, and then they can ask questions.
Okay, sounds great. Sorry about that. So this was kind of, this slide, just kind of an open invitation. If we could have some of you, as George just said, this is a little bit of different format, about how you're using these autologous exosomes in your practice. I have some examples of some marketing programs that I've built, and and did with some of you, the practitioners that are here online. But specifically, I'd love so that we can learn from one another and create this sort of peer-to-peer collaboration. Dr. Russo, I know you're using it. I know there's a couple others, but I see you on my screen of this script, so I'm going to call on you,
Okay.
if you will. We will talk about the marketing piece, but just overall, and because you did train with us and we're doing PRP in your practice as well.
Yeah, as Jill said, I've been doing PRP for many years, and I've been talking with her and Dr. Shapiro and Dr. Bellio for probably about a year now about PPX. It was kind of, slow to get started, but I actually started doing treatments about a month ago. And the turnkey solution kit that was provided by Jill was really helpful in getting it implemented in my office. It made it seamless, consent forms and procedure forms, pre and post instructions, and it all looks very professional. It's done very professionally. And I just put my logo on those. And so it was easy to get it set up. The procedures for training my phlebotomist and my injector was seamless also. So just in the last couple of weeks, I did a marketing piece. I sent out a newsletter and I did a video. So Jill and I did a little webinar, a little educational video that is really very good. It's very professional. There's a PowerPoint, and she and I talk about exosomes. And I've had surprisingly, I've had a tremendous response. We just posted it in our July newsletter, and I've had at least 10 people call my practice already. And we only marketed this to our patients. So it was a newsletter that went out email to our current patients. It wasn't to the general public. We're a membership-based anti-aging longevity practice. And so the email only went out to our patients. And I've done about 5 treatments already, and I have about another 10 people set up. And people are very excited. They understand the exclusivity. Several of my patients have gone out of the country for stem cells and even for exosomes, but it wasn't autologous. And so they were excited to learn about autologous exosomes, and were excited that they could stay right here in the country and get a treatment that they knew had regulations in place and safety and so forth. So I've had a really good response so far. The few treatments that I've done have been seamless. Patients tolerated them very well, and just looking forward to seeing how they respond.
Thanks, Kathleen. I just realized that my video was on my iPhone, so no one could see me, but I just switched it. But I don't know if Dr. Carolyn DeLucia is on the line, but
She is, yes.
Carolyn and I went to medical school together, so I know since 1985, and she's an OBGYN who's a professor. She's probably one of the experts in sexual medicine, more than most people. And she's been using a lot of these products. So Carolyn, you want to tell us about your experience? If you're available. Well, she's probably getting ready.
No, here I am. I'm just trying to unmute. I just got home, but I will say that I have had the pleasure of using the product for several months now. I've used it intravenously for cardiomyopathy. I've used it for sexual medicine, for both basically a supercharged Priapus shot. And the gentleman is 3 months out and reports unbelievable effects. Elderly, not elderly, I shouldn't say that, I'm the same age, but in his early 60s, who was having difficulty being able to have a successful ejaculation by himself or with a partner, and we call that delayed ejaculation. And he was now able to successfully complete both activities, which is life-changing, of course. And he also he had something where he would have some dripping post urination. So that is completely gone. And nothing else that he had tried had successfully done that.
Oh, awesome.
So-
Including PRP, Dr. DeLucia?
Oh, including PRP, correct. Oh,
Okay.
yes, we had tried PRP a year ago. And also Emcella, we had tried, and he said it worked for a minute.
Robin,
So,
I mean,
truly remarkable.
Carolyn, can you tell us a little, Carolyn, can you tell us about some of the products that you used for PPX in hair and skin?
Yes, absolutely. So for facial rejuvenation, absolutely amazing. I did my own hair, and the results, I had lost my hair after 3 times of having COVID and was really getting embarrassed. And lo and behold, using my own PPX, it's all back. And so thrilled. I'm so thrilled. And I don't need.
And that's interesting because a lot of people ask me, you know, should I use the younger amniotic fluid exosomes or should I use my own exosomes? But when we concentrate our blood, like a second generation PRP product called PPX, we're seeing better results than regular PRP, and we're trying right now to do some studies to see if it's similar to the amniotic fluid. But from what we're seeing, I think it is, because we're really getting that microRNA out. And I don't know if Dr.
Yes.
Robin Smith wants to talk a little bit about microRNA and how important that is. Robin, are you there? Can you pitch in a little bit on that microRNA if you're available?
I mean, I'll leave it to you, George. I think it's an exciting future of getting, like, as you said, a better understanding of the microRNAs and the differences between the exosomes, where they come from, and the messages that they're signaling the cells which they're intended for. So the more we can characterize and know about these products, I think the more personalized in some ways it becomes. And we're going to see a lot. We're working together on a hair growth product, and I think we'll see a lot more therapeutics and technologies over the next 5 years.
How long do you think it's
Yeah.
going to take until we have a signature exosome product where we can just say, okay, we're going to give you a microRNA 27B for your knee or a microRNA for your lung?
I mean, I don't know if Jody has a different view. My view is, we have to see how these become regulated a little bit more over time, and, the different data that's collected. I think, at the beginning of this call, before everyone jumped on, we talked about the importance of following the patients out in the data. So it's really going to be how much real world evidence the FDA will accept. And, a lot of this will be determined, I think, over the next 3 to 5 years. But I think we're going to see a emergence of therapies, and it's a pretty exciting field at this
No, it is exciting. Dr. Michael Bellio has done a lot of research with microRNA, comparing PRP to our PPX product. Mike, you want to comment on that?
Sure. So the first thing, I'll go back to the question you just asked about signatures. So what our research is doing is our company has really focused on the manufacturing of various sources of exosome product. So we have our allogeneic sources from amniotic fluid compared to our autologous sources of amniotic fluid. And when we look at those microRNA components of each product, we see the differences. And the reason we look at microRNA is because exosomes are truly just a microcarrier. They're lipid carriers that contain all of these microRNAs that are the therapeutic agent and a lot of the indications that we're trying to target. So we map out what are those highest expressed microRNA amongst the different products, because that's really what's going to tell us if one product could be potentially better than another product. So when we looked at our autologous product, we find that there is really high expression of these microRNAs that target inflammation, that target cartilage development. So a lot of those high expressed signatures in the autologous are one of the reasons why we think they're doing so well in some of these different topical and musculoskeletal applications. But nonetheless, to go back to just give a really quick overview of the other types of research we've done around autologous exosomes compared to PRP, because PRP was really, again, I guess the backbone inspiration of how we developed our autologous exosome product. We know that PRP is a mixture, it's really a cell product where it contains platelets, white blood cells, some red blood cells, and it contains the plasma component as well. So in the plasma component, there's exosomes, there's growth factors. So PRP is really this mixed bag of autologous materials. We wanted to be able to isolate and concentrate down only one piece of that mixed bag, because that one piece is what our research was showing to be the most anti-inflammatory and the most therapeutic components of that PRP. So our research, what we did is we made PRP from one donor and made PPX from that same donor, compared them head to head to show that not only do we concentrate more exosomes, so we can enrich the concentrations of microRNA in our PPX compared to PRP, but we can also enhance the anti-inflammatory action of the biologic, because we're concentrating exosomes and removing all of those other signals that may be counterproductive to the exosome signal. So we're removing the plasma, removing the cells, removing the platelets, and focusing only on the exosomes.
Awesome. I wanted to ask Dr. Russo, and I know it's sort of, how are you talking to your patients? Because this is fairly new implementation. You've understood about autologous exosomes. You've had a little hesitation, and that's really a lot of the people that are on this call. You know, they want to understand how to do it. You know, how are you doing it? But outside the marketing, which we're going to get to, but how are you talking to your patients, if you don't mind sharing? And maybe Dr. DeLucia and anyone else, please, who is on this call, chime in too. But Dr. Russo, if you don't mind answering that, that would be helpful, I'm sure, insightful.
Sure. It took me a little while because I really wanted to understand what exosomes are and what they can be used for, the indications, the safety, and attending several of your webinars and talking with both you and Dr. Schwartz and Dr. Biello. I've come to have an understanding, obviously not at a level of some of you, but so when I talk to my patients, I kind of talk about the basics. That's how I went through the process of learning myself. I talk about the basics. What is an exosome? What does it do? Where does it come from? What can it be used for? I talk about what the procedure is like, so they understand that it's a simple phlebotomy draw, and then I'm doing IV right now. So what that process looks like. So I kind of like walk them through what it is, what it does, what it's used for, and how we use it clinically in the office. And then, of course, I do talk about the Zeo Scientific, and that, you know, FDA certified and registered laboratory, and screening it. You know, I talk about safety, in other words, because that's typically when people watch my video, when I speak to them later, that's kind of the one question that they still want to talk some more about, is safety and how the process is screened and so forth.
Oh, that's great to know, you know, that they
Yeah.
that's kind of paramount in their mind as well. Yeah.
Mhm.
And I think most of you are using PPX. It is much easier than PRP because you're not having to do anything in the clinic, right? I mean, even your time, it's just a true blood draw and then sending it back to the lab. So has that made a difference for in your practice?
Yes, it's been, like I said, it's been seamless, especially with the turnkey solution kit that you gave us. But you're right. You know, when I do PRP, we use the M-Site machine, and you know, there's several steps. And in my office, my providers, my doctors, and myself, we actually do prepare the PRP. I know in some other offices they have nurses or assistants that do that, but in my practice we do it, and it is time consuming. So typically it's an hour appointment to, you know, to draw the blood, process it, and then do the procedure, where, you know, this is very simple and is not very time consuming. And I actually have my RN doing the actual IV process. I typically, because it's early in the process, I've been going in and being a part of that visit, but she does it, the RN.
Awesome. Is there any other providers on the call that want to chime in about how they're doing it, or if you have any questions for any of us? Now might be a good time before I move into the marketing piece of this. Or for Dr. Bellio or for George? No?
Yep,
Okay.
while we're waiting for anyone to chime in, I just want to say there's other things that we can do as a company. We're developing a lot of research right now. We're doing some studies with TBI, and we're nebulizing the exosomes. So we're having a nebulized form. We're also working with Dr. Robin Smith for a skincare application and a hair care application that you can actually take home, which is nice because when you get something in the office, you want to go home with something. It's always good to send a patient home with something. So that works out great for us as well. So if there's no more questions, you can put it in the chat or we'll answer them later. But what I like Jill to do, she put together this turnkey solution that was it's sort of similar to what she did to me like 10 years ago with PRP, but this is like PPX and change. But it's really easy for the provider to turnkey their office. Why don't you go ahead, Jill?
Yeah. Okay. Thank you, George. And I think what's really important to resonate with you and be sympathetic really to how difficult it is to implement a new protocol into your practice setting. It sounds so simple, and you go to a trade show and you get all excited and you hear doctors speaking about the next craze in medicine or the next frontier in all of regenerative medicine, and you want to be in the know, and you want to be one of those pioneers. But it's difficult. It's difficult to translate that excitement into a success in your practice. So what we've done is we know what it takes. We know what the challenges were. We understood the problems in translating that into success and all the hurdles to successful implementation. So we came up with a solution, and that's really what this is. So it's kind of a proven success, if you will, because we have, but doctors like Dr. Russo, who she said, okay, tell me what to do. And was like, okay, fine, this is what you do. And I think she's like followed everything that we've done and has become, or telling her to do, and it's become a success. Now, this isn't, a one size fits all, but that's what we're here for, to really help. Each one of your practices are unique, but we want to help you translate this modality as successfully, because you really can help patients and you really have the patient offering. It's such low-hanging fruit. Very little of this marketing has to be done outside of your practice, meaning you don't have to spend money to market out, advertising. You can really educate your existing customer base with this real these strategies and programs that are already built, and we want to help you, do it. So I just wanted to say that I know it's kind of like there's a saying, it's super simple, but it's just not easy. And it's true, it's not easy. So we understand that. Don't be ashamed of that. Ask us for help because we understand.
This playbook, is this just strictly for hair, or is it?
Oh, no. So I'm going to keep going. Sorry. No. I'm going to demonstrate one. I'm going to quickly share my screen elsewhere. Hair is one I want to just show you. We built this for every modality, for MSK, for aesthetics, for IV, for musculoskeletal, for what else, Tammy? Inhalation. Yeah, so we've built them for them all, but this is the example. So let me go back to share my screen. Sorry. I was really trying to get this built into my deck, but technology was not my friend today. So this is a playbook. I'm going to go real quick. I'm just going to show you we built, and this is all white labeled. So you can put your own logo on this, your own address, everything. And you can even use some of it, or, repurpose, and not necessarily all of it. But we did informed consent, showing all the contraindications. And these were all looked over, by the way, legally. We did, so here's one for the microneedling and hair, those consents, with all the side effects and results. We did patient testimonials, video and photo release. Again, this is just this worked, and we knew what we needed in other practices, so we emulated this to exosomes. This is a hair loss questionnaire you could use or not use, pre and post procedure instructions, literally just everything that they need step by step. Even photograph documents, so you can 6-week, 20-week healthy hair. That's like a content you could maybe share if you wanted to communicate with your clients. The medical supply checklist, literally a checklist. You can check it off. You need 2 mLs of PPX. You need the disposable shoulder grape. You need HiPoCleanse. I mean, really, there isn't anything we didn't think of. Here's the actual procedure protocol. So you have it written. Again, this is truly turnkey. There's for microneedling. If you wanted to do a ring block, we have instruction on that. We added research to every one of our modalities. We added the research. So MSK, we have a bunch of different studies, and not all of them,
Jill,
but
before you go over that, there's a question regarding the hair about
sure.
protocol and CCs. So I was doing probably about 4 or 5 cc's diluted in the hair with exosomes. And some people have a problem with all that fluid going into the scalp, and it goes in lacrimal ducts, and they left the office, their eyes were swollen. So I try not to do too much fluid and volume, especially in the scalp. There's a vibrating device that you don't need to do a lidocaine ring block if you don't want to do that. It's an anesthetic device developed by an anesthesiologist, and Jill, maybe you can help get that.
Yeah.
But the exosomes are concentrated. They're like 250 to 500 billion in 1 ml. So if you just you can do a 2 cc dilution, and then you can do 0.1 cc, 0.1 ml injections in different areas, depending on how much you need to do on the scalp. If it's one region in the front and then the crown, you may need 2 cc's of exosomes. Usually when I do a joint, I'll do 1 cc intra-articular, non-diluted, and I'll do 1 cc non-diluted IV. So it's you don't need a lot of volume because they're very concentrated. Usually in the small joints, you can use low volume, but in something like a hip, you can use more volume.
And as you know, with PPX, you get 2 doses, 2 1 ml doses. Dr. DeLucia, do you want to speak to that? She's done the hair a few times using this product. So I don't know if you have anything to add to it. It did not take any more than that volume. In fact, I think you only used 1 ml. Is that right?
What was that, Jill? Who are you talking
I was
to?
talking to just asking Dr. DeLucia, but she's still there, but she's got her mute on, so it's okay. I'm going to go back to my presentation. Any more questions, George? Did you see that?
It did just let me unmute finally. I'm
Oh,
sorry,
okay.
guys.
Sorry, I don't know why that.
I did use just 1 ml of the PPX. I did not dilute it. I just put it in a 1 cc syringe and just put absolutely minute aliquots into my scalp along the receding side and right down the part, and then just used as much as I had left for the rest of the area. And the results, as you saw the before and afters, so truly remarkable.
Awesome.
Yeah, so it's not really a lot of volume, because
No.
the exosomes are so concentrated in that 1 ml vial, you really don't need a lot of volume. And when you do PRP, you may have 7, growth factors and minimal exosomes in that 1 ml. So you need more volume with the PPX, because they're so concentrated. You do not need a lot of volume. Less volume is less swelling of tissue and less pain. Not one patient that we inject complains of any pain, and we have not one safety issue or infection ever.
Do you, when you're doing hair restoration, do you do 2 treatments 4 to 6 weeks apart, or?
I like to do 6 weeks apart. Some people like to do 3 months apart.
Okay.
Usually, the hair cycle, anaphase, cataphase, telophase is like 6 weeks. So I'll do day 1 and then come back 6 weeks. Sometimes it's 3. I tell them, we're going to do 3 treatments, 1 month, 3 months, 6 months.
Okay.
And we are having quite a few patients who were not successful with PRP for hair growth that are responding right away with PPX. So, I mean, we have before and afters on that. So, yeah, and as George alluded to, we're going to be launching a new program with Dr. Smith for hair regrowth. That's even going to be more spectacular than just the PPX olive in its own. So,
You
yeah,
know, that's going to be really interesting because that's going to be a lot about, again, signature exosomes, hair growth peptides, and different products. So, and again, people like to go home with something. They want to go home with something. So, especially if it's related to a regenerative biologic that's advanced, it's not just a regular cream. It's really a regenerative material, and that's where the field is going today.
Yeah, and
I-
combination therapy is proven to, be the best plan of action. Does anyone have any questions to that playbook and what's involved? And as I said, allude to all the different modalities that we've built this for. So what do you, here's a question. What do you use to dilute
Normal
the,
saline. I use normal
Yeah.
saline. What do you use, Kathleen? Kathleen,
I don't dilute.
Yeah. So sometimes I'll dilute a 1-to-1 dilution. So I'll have one. So, if someone has, let's say, 2 shoulders to inject or a knee and a shoulder, I will dilute it with 1 cc. So now I have 2 ml. So I'll do 1 ml in the knee, 1 ml in the shoulder. We don't know how many billion units do you need to regenerate tissue or to reduce pain. That's a phase 2 trial that we're currently starting to do, but nobody really knows. Do you need 1 trillion exosomes? Do you need 500 billion exosomes? Do you need 50 million? No one really knows.
right? Okay, so to continue, so this, in addition to our, business in a box, one thing that we know is many industries were built on seminars or patient education. Oh my gosh, and since COVID, it's certainly doing webinar type education meetings is super successful. Dr. Gelfi, you're on this call. We built the whole BHRT industry on every month doing a seminar for your patients, and the whole LASIK industry was born. So we know that's a proven tactic, and we built an entire program for you to market a patient seminar, and this can be in the form of an in-person or a webinar. So this is one we did for one of our clients. Ever since he started doing these, and he's doing them once a month, I think he goes through 10 PPX kits a month. That's no lie. So I'm just going to show you a quick example of this little flip book. So, and we built the whole deck, and then we can customize this for you as well. You can just insert your pictures, the doctor's name and the clinic name, what you're going to cover. And maybe you only want to cover, for instance, he talks about everything because he does everything in his practice, and he's nailed this down. He can go through this seminar, and he does them in his office in 40 minutes. And then he does Q&A, and he's out in an hour. And this has become very successful for him, as I said. But anyway, you could customize what you're doing. So we built this. So he gets to talk about regenerative medicine. He talks about exosomes, how they work, the basics, how it's been used in medicine. Again, education and awareness is key. And you've got, some patients are coming, consumers drive this demand. They're coming to their doctor saying, do you do exosomes? I heard about these exosomes for hair. So it's really important that you are, you're going to kind of get left behind if you're not being able to share that you do know this. The different delivery methods, sorry, I didn't mean to go through that now. This is,
Jill, if you just go back a couple of slides, is this physician on the call?
Actually, he texted me, Dr. Cunningham, and he's so sorry. He had an urgent personal matter, and he said, "I'm so sorry, I'm not going to be there." This morning he was, and I was like, "I'm going to put your picture." And he said,
just go back a couple of slides on this
"Sure."
presentation, just for the audience. So when you see, go to the next slide.
No, that's the beginning.
No, not back. Go forward. You went
I'm sorry.
Right here. So whenever we see here, exosome therapy, whenever you're marketing exosome, there was another thing about what they do. I don't know if you have that. I think it was a few slides ahead. You went. Keep going. Oh no, keep going.
Autologous
No, I
exosomes,
must have
breakthrough.
Anyway, you just want to make sure you put in autologous exosomes. You don't want to make claims what it's used for. You want to make sure you're talking about regenerative biologics. The FDA hates the word exosomes alone. So I wouldn't, unless you're talking about basic science of exosomes, but if you're talking about products and making claims, just be careful. Don't put it on your website. I would put autologous exosomes is fine, but I would not, the FDA is they have these key words, the hot words like stem cells, exosomes. You just got to be careful. You want to preface it with autologous exosomes.
I'm going to show you an example of that. Okay, George, let me do that because this is what we did for, we just used George as an example here. Sorry, 1 second. Let me share my screen. Thank you guys.
Jill, I use the term exo-age on my website.
Exo-age, okay.
Yeah, EXO-age, and then underneath it, I talk about autologous exosomes, but the keyword is exo-age.
So this is just an example, you guys, and this is an in-office promo flyer. So this is another collateral asset that we've developed that turnkey that you can use. So you say, okay, great, Jill, I want to do a seminar. What do you have? And I said, okay, here's the deck. You can customize this deck. We can customize an in-office flyer so you can promote it within your practice setting. Sign-in sheet, email content to pro. So here's one. So it's discover the powers of autologous therapy. Regenerate, restore. We just talk about non-invasive procedure for wellness and longevity. We don't say just exosomes. We talk about autologous therapies, just a little safer way, as George was alluding to, or just talk about here they are good towards any regenerative therapy treatments. Just to be safe, as he said, it's you don't want to. It's kind of a gray area, and there's just be smart about what you're doing. And we've been very thoughtful in our marketing pieces for you. Is that helpful, George?
Yeah, and if any practitioners are concerned, they want us to look at it before you put it on your website, we can look at it and make some recommendations for you. You just don't want to be out there making claims about exosomes. It's a hot word. They look for those words. They look at your websites, and you don't want to get a cease and desist, and you don't want to get anything like that. So you want to do it the right way. And Dr. Robin Smith agrees with me wholeheartedly and myself, we're very careful about what we say and what we do. We really want to be on the right side of the line.
Yeah. Okay. And so the whole deck, again, like I said, could be customized. I'm going to show you something else we've done that has worked brilliantly. And I did this before with I don't know if it was just PRP. It was a bunch of different things. It was hormone therapy, PRP. But so this is something I did with Dr. Russo. I'm gonna show you. This is a flip book. So I made this deck. You talked about this a little earlier, Dr. Russo, what we've done. So I did a Zoom interview with her. So I built the deck. I introduced her. We recorded the Zoom like we're having a meeting tonight. I built this little deck for her. She spoke to it. I introduced her. I'm delighted today to be with Dr. Kathleen Russo of Carolina Healthspan. She's going to talk to your patients, part of her education series about exosomes, something new that she's implementing in her practice setting. So it was like a handful of slides, how they work, the power of exosomes, the diseases they target, how they're being used, in medicine. She goes into autologous exosome. That's what she's doing in her setting and how it simply works. I think this recording was maybe, I don't know what, 7-8 minutes, 9, I don't know. It really was fairly short. Oh, you're muted.
Oh, 13-15 minutes.
Okay, there you go. And then she took this and then she said, okay, if you're excited, again, this was to her own patient. She wasn't marking
Just
this
go back
outside.
go back a slide on that, Jill.
Sure.
So what's nice about this slide is as clinical uses. It doesn't say, curing osteoarthritis. It doesn't say curing, different things. It's just what they're using it for. So it's really important how you market this and done right. This is done really excellent.
Yeah. And then she took it. Oh, are you guys there? Sorry.
Yeah, we're here.
Let me stop my share for a second. Then she took this this recording, then like 2 minutes after I hung up the call, Zoom sent me the cloud recording of this MP4. I emailed it to her and she repurposed it for her, or remarketed for her website. And I'll show you what she did. This is so cool. And this was, on her own, but being able to help you develop a collateral asset is nothing shy of brilliant, guys. Let us help you do this, So she put it, sorry.
You know, a lot of companies don't have a Jill Schwartz or a Tammy Bano. So whoever's a physician provider on the call, reach out to us and they will help you and make your life easy.
Yeah. Again, so here's what she did. She sent it out in her newsletter. She had a link to the actual MP4. And what did you already said? You had like 5 calls and
I've had 10 calls of people wanting to have a conversation with me to talk about more about the therapy.
that's so
Mhm.
awesome. And then here's some more stuff that we've built for different clients. So we have trifolds. Right now, I'm actually building the trifolds in process for different modalities. So one for sexual wellness. We have a general one on autologous exosomes. But here's like a poster. We have brochures. So we can, you know, if you want something customized for your practice, we can help you with that. Again, that's huge, because if you had to go pay somebody, you know, pay a marketing, this isn't like rocket science, but if you had to pay someone to do it, it would you know, it would not be cheap. So we've done it, we know what works, we want to help you. So yeah, so that's it. I hope there's some questions, and maybe not. Maybe you all want to just jot down Tammy's number real quick, because it's like, okay, yes, I want to do these things, and we will schedule these Zoom things. Are super easy. Yeah, we'd love to talk to you, because a lot of you have bought these kits and I know you've shied away from using them, or you've only used them once, you're having trouble talking to your patients, or let us know that the whole spirit in which we come today to deliver this talk and this meeting is to like learn from one another. I want to know why you're not doing more. I want to know if there's something more we can do as an organization to help you. And I say that sincerely, you know. I mean, sure, we all have an agenda, right? We want to do more with this, but it takes a village, and this is not a quick sell, and this is not a quick conversation to your patient, but it certainly is a very effective therapy, and we want to help people. So yeah, that's all I have. But is there any questions here? Oh, there's a few here. Oh, Bob, you're going to answer when I'm done. 1cc.
I answered Bob's.
Oh, okay.
They're all answered.
Okay, awesome. Oh, you're a step ahead of me. I wasn't paying attention there. Well, I just want to thank everyone for taking the time out of your evening. Each and every one of you have stayed on this whole time. I hope it was informative. I want to continue these talks and these collaborations is really what they are, because I think we can all help one another learn what we don't know and learn what to do better. And as the protocols develop, you know, we can tweak them. You all are going to tweak them in your practice anyway.
Can I chime in with something real quick? I'm so sorry to interrupt you. Hi, I'm Tasha. So I work under Tammy. She's absolutely a wonderful soul. I absolutely love her. We've been using the autologous exosomes turnkey boxes in Dr. Bano's office for quite a few months now. And I've been rolling through all the changes that have been made with the consent forms to the shipments, how things are packaged or processed. And I've been the main person that collects the sample, registers the patient, gets the information, packages it up, has it sent out. When it comes back, it comes to me. And then I'm also the person that gets everything set up for the patient for the injection. And we usually use it for sexual wellness. And so I have noticed that it is so simple. Like for me, at least, I am very appreciative of having the box, having everything there together. The directions are very clear and concise, and it does make it very easy to collect the sample from the patient. I've done it so many times. It's really easy to usually answer a lot of the patient's questions. And majority of the patients that I do have are ones that have done platelet-rich plasma therapy in the past for either ED or having that from a venous leak or different other diagnoses therein that they would need it. They also, these same patients that have had platelet-rich plasma therapy in the past have came back to us after having exosomes and have had nothing but good marks to say about it. I've even had patients do multiple rounds of it. So from I say a user standpoint, from using the turnkey boxes that you guys have created and seeing the patient impact on it, I am absolutely pro exosome. It is a fantastic,
Aw,
it's a whole fantastic process. A procedure. Like, I am looking so forward to using it even more. And those that are on the call that are hesitant towards it, I definitely can speak from experience myself, from having, my patients come in and tell me that not only do they have, better, activity in the bedroom, but we have some that we've done IV infusions with. They have, less arthritis pain, more mobility with their joints. Like, we definitely love it in our office. So
thank you
you.
for sharing.
Tasha, I'm going to answer a question from Bob since, so Bob, I'm Dr. George Shapiro. I work with a company called Fountain Life. And what we do is we have a large number of patients who we do hair, knees, and pulmonary procedures as well. So the cost for us is $1,500 for PPX, and we get 2 vials, 1 cc, 2 vials of 1 cc each, and we sell each vial for $3,800. So for the $1,500, we're bringing in $7,600. So it's a good profit for the office. As far as what do we charge for hair, it depends. If we're doing like a microneedling and we do a little bit more, we'll charge maybe $4,500 for hair or $5,000 for the hair. Again, it's costing us $1,500, but we're charging a little bit more because we're doing a little bit more things. And we may want to give some, we're going to be bringing up some new formulas that we're going to put into it. So that can be put in the price. And that's going to be with Dr. Robin Smith collaborating with us for a hair formula and so on. For knees, it's $3,800. We'll get it for $1,500 and we'll charge $3,800. So that's our price in Fountain Life. I don't, some doctors charge $4,000, some charge $4,500, some charge $5,000, depending on if they're doing laser therapy in the office. Some people do lasers with exosomes. Some people do other things. So it's anywhere between $3,500 to $5,000 a procedure.
I don't know if you can hear me. This is Bob Gilfie. Can you hear me?
We can hear you.
So my understanding is it basically requires 2 visits to the office. They come to get their blood drawn, and then is it 2 weeks later or something like that you
It's
schedule
about 10
that?
days. It's about 10 days later. It depends. Some of my patients will have a phlebotomist go to their home with the kit, and they draw it in their house. So when they come to the office, it's already in the office. So that can be done ahead of time. Locally in South Florida, we have that. We have that ability because we have a local phlebotomist who go there with the kit and draw it. So there's not, people don't come in. We also have other products, because we were doing research protocols. I'm not going to get into now, but I can talk privately with you, and then we can talk about, sometimes we give someone one of the, original amniotic fluid products if they're there, if they want it, and then we'll do the exosome product.
And George, if I can add one thing to that, Bob, and knowing you and your practice very well, as the other real important component of this is the PPX. It's working for hair regrowth, and that speaking back to this exclusivity, there is a perceived exclusivity. You're using your own exosomes. You're gonna get a result. It's not that 50% maybe will work. And not only that, they're very I'm losing my train of thought. They're very we're testing for all kinds of endotoxins. They get a very the FDA approved lab coming from. There's a way to sell this differently.
So I'm not the best salesman in the world. We know that too, Jill. But what's important when I started this conversation too is that there be some sort of way of having ongoing evaluation of, because it's an investigative procedure. I mean, that's what I would tell everybody. I would tell everybody if it's an investigative procedure, because we don't know, I don't know what percentage of knee arthritic patients are going to get better with autologous exosomes. Does anybody know?
So if you know about PRP, there's been a lot of research with PRP.
Yeah.
This is the same as PRP, except a little bit stronger. It's 2.2 times stronger than PRP. So
But I think that I understand that it's theoretically better. I do autologous stem cells a lot, and I gather data from all of them, but they're not very good studies, to be real honest with you. I don't like that part of it. They're mostly saying, this guy got a lot better. And that's not that appealing to me. I like that because they get better, but not everybody does. And so my point has always been, I like the idea of having some sort of ongoing study where the people that are using it can contribute something, some sort of data.
So we're actually we actually did a study looking at PPX in patients, comparing IV and IA with 10 patients. We did a 1-year study, and we also looked at blood biomarkers and WOMAC scores. So we saw a significant improvement. Believe it or not, the IV was better than the intra-articular with autologous exosomes, which I was surprised, and so was Dr. Bellio. But right now we're gathering data. So Fountain Life has been around for 4 years. We have 6,000 patients, and we have a generative AI program now that's looking at a lot of the data. So now we're able to start getting some of the data because we've been doing a lot of injections. Initially amniotic fluid exosomes, now PPX. So that's coming, but we're collecting all that data now ongoing, and it's an ongoing data collection process. So that'll help answer that question.
I appreciate that. I guess this is a lot simpler than adipose-derived autologous stem cells, which is what I do now. And I always give IV and intra-articular. I do both on everybody.
Yeah.
And I do PRP with the stem cells. I do both, and I don't really know why. I just do it.
Right. So that's what I'm saying. So we don't know why we're doing PRP. But
I know. I want to. I guess my point is,
if you think of the PPX,
we've been doing it long enough that it seems like we should have data that supports what we do.
So we looked at the data on PRP, and it's not really there. There's a few articles here or there. There's practitioners like Chris Centeno, who I know Chris really well. Me and him were on the stem cell committee at Age Management Medicine Group. We did day lectures. He's just so pro PRP because he started that business and he invested millions of dollars in it. But, if you think about it, as a physician, you're injecting something back in and you don't know what it is. You think we know what it is, but it's not really. I mean, as doctors, we spent 14 years of training. What are we really injecting back in the patient? I'm not looking under the microscope with PRP, but with PPX, we are looking under the microscope. And I remember training with some of these doctors when in these urgent care centers where they'll come in for some fungal infection. We'll look under the microscope, add KOH to it, and we'll see the Candida hyphae. We'll say, okay, you have fungus. Now we're going to treat it. We don't know that with PRP. We're not looking under the microscope, but with PPX, we are. Our lab, and you should tour our lab. I don't know if you toured our lab or any providers on the call, you should come in and tour the Zeo Scientific lab, and you can see exactly what we're doing. We're doing nanocyte reports. We're doing transmission photography. We're looking actually at the exosomes moving. It's pretty impressive.
I really, the theoretical aspects of what you do and I do make perfect sense to me. I've just been anxious to be somebody who's providing clinical data. I'm mostly a clinician. In fact, I'm only a clinician.
Right.
So in the other areas of medicine, there's prospective, randomized, blinded, all kinds of, the way that we're doing the science in this field is unacceptably lousy. And in terms of actually having data that means something.
Right. I agree 100%. Dr. Bellio, if you're still on the call, can you mention some of the studies that we're doing right now? We're looking at some of these double-blinded, placebo-controlled trials going forward.
Yes, for sure. So we do two primary things in our company. We do research and development work in the laboratory, and we do clinical research as well. So on the research and development side, we do a number of in vitro bench assays looking at how all of our products, amniotic fluid derived, PPX derived, how do those exosomes suppress immune cell activation? How do they lower biomarkers of inflammation? So we have a lot of data there that really is the mechanism of how our drugs work. So then on the other side, on the clinical trial side, we started with our amniotic fluid products where we've already completed some phase 1 studies in COVID-19, an osteoarthritis trial. So we've collected some of that initial basic data of what were some of the outcomes in those groups. So we're following a similar path with PPX. We've done our first pilot study for osteoarthritis, and now we're going to be doing some erectile dysfunction studies as well, but we are in the process of gathering that data. But what we have now is published. So we do have a lot of that bench assay data. Some of those phase 1 trials are published and available to use as a guideline for what are the basic mechanisms and some of the initial data sets that we've collected for our products.
Well, I mean, even like with knee arthritis and the WOMAC scores and that kind of stuff, it doesn't seem like it's that hard to gather data in a clinic. It is hard to do, very hard to do blinded studies, really hard, especially when someone's paying for it. It seems like there should be places in the country where you could go actually get funding for something like that and convince people that have maybe bilateral knee arthritis to have one side injected and the other side injected with saline and see how they do without telling them which one is which one.
We actually could do that. We actually did an osteoarthritis trial of the knee, and it had to be there's 4 stages, as you know. 1 is normal, 4 severe, then 2 and 3. So we looked at patients and we did a baseline blood test looking at CRP, homocysteine, myeloperoxidase, TNF alpha, interleukin 6, and we measured them over the year, and we saw a 70% reduction in the inflammatory biomarkers and a 70% improvement in WOMAC scores just with 3 injections of exosomes, day 1, day 3, and day 8. I mean, and we, so this is published already. So we're, but that was published with amniotic fluid exosomes. That was early before the guidelines came. Now we're looking at studies with PPX.
Can I just say something? I just want to point out something that you've all been saying, and it brings up the question of being able to do a study with doing one knee and not the other. You see, the exosomes themselves are decreasing the inflammatory markers in the bloodstream. So it's full systemic result. It's not a local result. And that's what is key here. It's key and it's fantastic.
No, it's a great point, Carolyn.
Thank you.
So Bob, I don't know how we're going to do that with one knee.
Exactly. I can't do it with one labia and not the other. I'm thinking the same.
Yeah. So
hey, Bob, can I ask you what you charge for
1 second. So Bob, I got IV stem cells 3 years in a row already because I do everything. I try everything on myself. So I did IV stem cells, IV exosomes. We even did ultrasound guided exosomes, but focus ultrasound for exosomes across the blood-brain barrier to reduce, hippocampus age and reduce brain age. So we're doing a lot of interesting stuff. I mean, it's just, we're all about science. And, as chief medical officer of ZEO, but I'm also the chief medical innovation officer of Fountain Life. So I have a whole patient base of 6,000 patients to study on, and they're all interested in biologics, all of them. So we're doing a lot of science, and if you want to get involved with some of these trials, we'll be happy to enroll some of your patients in this.
I'd love to. That's great. Go where you saying.
Got to use that PPX kit though.
Yeah, no, we're going to. I have a lady that's coming in for hair tomorrow, not for PPX. I'm just going to tell her we're going to do PPX on. She'll do anything. This lady, when women lose their hair, they'll do anything to get hair.
So can I ask you, because a couple other people had asked me here privately, what are you charging? What are you charging for MSK? What are you charging for hair? And then Carolyn, you wrote what you are, so I'm sure people want to understand.
So for exosomes, for amniotic exosomes, which we do for pulmonary, we charge about $3,000, and they cost me about $1,200. And we just do IV and nebulized. We do both. We do, and they send 5 cc's. It doesn't really matter, right? I mean, you could dilute it. They dilute it to 5 cc's where I get it. And for
the only company that does 5 cc's, I know the company, it starts with the K.
Yeah, you do. Yeah, it's Chimera.
And you can get it from us, Bob.
Well,
no, I understand that. I'm just telling you what I've been using all along. And
I'm not happy with Dunkin' and his products, so I don't trust their products. There's no nanocyte reports. I don't know what's in there. We haven't seen it, so I would second guess that. But go ahead.
I'm happy to use autologous exosomes. It's It's a
But if
little,
you
it's
want
a
to
little
still
bit
use,
more.
if you want to use still the non-autologous exosomes, we have a better product anyway that we use
Okay,
as part of
great.
our research. So you can.
That's great. So I'm just telling you what I have used. And when we do autologous stem cells, we charge 7,000 because it's a liposuction. It's more involved
No,
for us.
that's good.
And that's not, and honestly, it's a labor of love for us. We really aren't, our bread and butter is the practice that Jill helped me start all those years ago. This is just something I think is the future of medicine. I'd like to be involved in it, but I don't want to be stupid. And I don't want to make promises that I don't want to tell people I can help them when I don't have a pretty good idea that I can, especially when they're shelling out a lot of money.
Yeah.
For them, right? For some of these people, it's a lot of money. And so that's really what I've been really careful about, is knowing the right indications and not telling people I can help them when I don't have a pretty good idea that I can. Hair is different for me because it seems it's so cosmetic. It's like, hey, we'll try anything. We'll just throw the kitchen sink at hair, right? There's a bunch of supplements. You can do everything for hair. I don't really care about hair that much. I mostly care about function, not form. So I like arthritis and I love pulmonary treatments because those people are miserable. If you can make them less miserable, you've done good.
We're doing we've been talking with the Mayo Clinic. We already got approved for an IND or actually an IRB with the Mayo Clinic for COPD.
Yeah.
And Dr. Robin Smith is doing a lot of research with pulmonary fibrosis and figured out a microRNA number, a specific microRNA that can repair the lung and turn a rubber lung into a normal lung. So, I mean, you know, it's the future of medicine, no question about it.
Right. Well, I have 2 kits, Jill. I'm going to use them both. One on Meryl Lee and one on this lady I'm seeing tomorrow. So there you go.
Awesome. I'm excited for you. I really am.
And I'll work with you on the other stuff too.
Carolyn,
wait
would
till
you
Monday.
mention?
Wait till Monday, Dr. Gelfi.
Oh, yeah.
No, I will. Yeah.
Wednesday.
No, I'm just talking for it tomorrow. I'm just saying, no problem.
And Carolyn, you mentioned, and there was a couple of other people that were interested in hearing asking about what we charge. You charge in your office for was that to hair? What you had mentioned in the chat?
No. I actually charge them to create the PPX in and of itself, separate from any procedure. Then they pay to use their own PPX, the cost of the procedure.
So what's your cost of the procedure?
Mine for the procedure is just my time, typically. Obviously, it's just the injectable. And yet, so let's say I charge $2,100 for a priapus shot, and I'm using the PPX, they're going to pay $5,100.
Right, yeah, so it's about $5,000. That's what.
So she charges $3,000 just to make the PPX.
Yes, no, yeah.
Yes.
So that's an interesting way to think about it, guys. Again, this is how you kind of love it, Carolyn. Thank you. Learn from one another.
Well, yeah. I mean, I have to, because I can offer them several different stages or levels of complexity in my regenerative medicine armamentarium. So,
and guess what? You don't have to compete with anyone on the price of PPX because no one else is doing PPX. You know what I mean? So there you go. That's actually brilliant. I love it.
Most people double, that's most physicians will double it. So you get it if you pay 15, you sell it for 3.
Right. There you go.
Yeah. But super way to play on that exclusivity. I love it. Okay. This is amazing. I'm so grateful for all the interaction. Dr. Cindy, do you have any questions? You're sitting back there, Dr. Hall.
No, I don't. I just have to learn how to do hair now. So I need to probably take a course or figure out.
No,
how
we
to
got
inject
that
the
covered.
scalp.
We can help you. Yes.
Perfect. Sounds
we
good.
can actually, yes.
I'm GYN, so hair loss is a huge problem for women.
So am I.
Yes. So is Dr. DeLucia. So we can put you together, offline, and no, really, we can help you with the actual training. But my gosh, amongst ourselves within our own network, that's what we're trying to do. Really, with one another, you learn best from each other.
Thank you. I appreciate that.
Yeah. Where is your practice?
I'm in Glenwood Springs, Colorado. So I'm between Aspen and Vail.
Okay.
Mm-hmm.
Yeah, I met you before, Cindy.
We met online.
Yes, we actually spoke. No, it was you had some questions about your practice. We spoke.
Yes, it
Bumble.
was nice.
No, I'm kidding. Oh, well, everyone, I'm very, very appreciative. I think, I hope everyone got Tammy's number. I'm easy. We're all our first name, last name at Zeo Scientific. So you know how to get in touch with us. There's Tammy's, and you can get right on her calendar. But I'm so
Tammy, reach
appreciative.
out to Cindy from Colorado.
You bet.
Okay.
Yeah, and we'll continue these education meetings, we'll call them. And because that's the whole goal is to really move this forward as a group. And I'm very, very thankful that you all participated and joined us and stayed on this long, and we're super, super appreciative.
And if
Yeah.
anyone needs to talk to me directly, you can just get my information through Jill or Tammy, and I'll be happy to set up a call.
Thanks,
Okay.
everyone.
All right, everyone. Well, have a wonderful evening, and yeah, I'll be sending a follow-up update on this.
Jill, great job. Great job to my team.
Yeah.
Our team. I mean, Tammy's great. Thank you, Michael.
Thank you,
And
George.
Carolyn and Kathleen Russo and Bob. Great to meet you.
Thank you.
Okay, guys, thank you.
All right.
Take care.
Bye-bye.